Hi, I'm Christine Travis. I'm the VP of Sales with Agency One, and I'm here with Candy Costas, co-owner and president of Privatus Care Solutions.
Right.
I wanted to speak to Candy today just to talk a little bit more about why clients should plan ahead and become familiar with resources in their community when it comes to experiencing a long-term care event. And I ran into Candy when I was traveling and found out what she did for a living, and she's also a very dynamic public speaker. And so I did follow her to an event and watch her speak and thought, hey, I would love to get her to talk to us about what Privatus does. And Candy, you have a background in nursing. You have a degree from Boston University. Candy started her career in medical sales.
Correct.
But from there, segued into working with Privatus. So I'm going to let her tell that story.
Sure. I worked as a nurse many moons ago, and then I decided to take time off after starting in medical sales to raise a family. When I was ready, when my children were older, to get back into the workforce, I started to talk to people about opportunities that might be of interest to me, medical sales and other.
Yeah.
One day a recruiter called me and had an opportunity with a startup company selling high-end home care services, highly focused on customer service. It seemed to be a perfect fit for me because it combined my love for the finer things in life and my love for helping people, being a nurse. So I joined Privatus on 6/6/06, almost 20 years ago, and here we are today. We have 8 offices spanning 5 states.
And you know, one of the reasons I am enamored with Privatus is you do some really great work, and you do it in unique markets. You know, higher end, higher net worth clientele. I always have advisors ask me, at what point does a client not need to hear or plan for long-term care because they have enough money, and what's that number? And I say, there is no number. It's really about the client, what they want their experience to look like, and also where do they live, what resources are available to them. So Candy, tell us a little bit more about the type of care that Privatus provides in those markets.
Sure, we provide basically 2 levels of care. The home health aid level, and then the higher level of care, which happens to be nurses.
Yeah.
The nurses are not necessarily used for situations most people think of, such as for wound care or IVs. They are more educated, so they're able to be an advocate for our clients, so they could travel with them. They could be in the home and recognize subtle changes day to day, pick up the phone, call their physician or other healthcare provider. So it's basically 2 different levels of care, depending on what's important to the client and what they're looking for.
Yeah. And one thing that's important is for people to have a plan in place before the time gets there. Talk to me about how you can have a more fruitful conversation with a loved one and make them feel comfortable and in control about having a plan in place.
Well, most people, when they call us, it's generally in a point of crisis. As much as we can advise people to have the conversation in advance and plan ahead, it's not something people like to do. We feel like we live a healthy life, we exercise, nothing's going to happen to us. But accidents do happen, and it's always better to have those conversations in advance. I remember one day before my dad passed away, he was at the point where we didn't think he should be living alone anymore.
Yeah.
So we went out to dinner. Over a glass of wine, I said, "Dad, have you ever considered assisted living?" And he said, "Yes, I have." And I said, "Would you consider it?" "I would," he said. That went really easy. Yeah, all parents might not react that way, but I think it's better to have the conversation before the crisis happens,
right,
over a glass of wine or going out to dinner or coffee, rather than waiting for the time when they fell in their in an emotional state.
Absolutely.
So have that conversation as soon as you can.
Yeah, and I think a lot of folks that they don't realize what it is such a vulnerable state for a client to be in, emotionally, physically, sometimes financially too. We talked about the higher net worth markets that you provide care in. Tell me about some of the types of care or the resources or things that you can provide to clients that are unique perhaps to other markets.
So with the higher level of care that we offer, we can do just about anything, from helping people that are clinically complex, and it's almost as if they were in an ICU at home. Other situations that are unique would be helping people traveling, whether it's to a vacation or if there's been a medical emergency. We helped someone who had a spinal cord injury in Switzerland, and our nurse provided an escort to that client, bringing them back here to the Boston area to be treated.
Okay. And I remember a conversation we had a couple months ago, and you told me you had just placed a full-time caregiver on Nantucket. And when you're in a situation like that, it does tend to cost a little bit more than, you know, just hiring your average person to come in and assist. Talk to you about the levels of care that you're able to provide inside of assisted living and skilled nursing, because a lot of people don't realize you do get a baseline of care in there, but there may be only certain things that you receive that you might want to give more to a patient. How does that work?
Sure, we do and are able to provide services even in the hospital, in an assisted living, or in a skilled nursing facility. Sometimes people just want someone there at the bedside, so their loved one is not alone, someone just to fluff the pillow. At other times, they want the higher level of care, so it would be the nurse that can be an advocate, that can understand what's going on and perhaps act on their behalf while they're in the facility.
Yeah, great. And just one last question. I would just love for you to give your opinion or your viewpoint on why it's really important for families to get out ahead of this and have these discussions in advance. What does it mean to the person in the long run if they do have a knowledge of resources and options and a plan of care in place?
I can't stress enough how important it is to have those difficult conversations with your loved one. And I'll give an example again of my dad, who was living in a lovely assisted living, but had limited resources. And I remember one day my husband said, "I had that conversation with your dad today." I said, "What?" He said, "I told him basically you have three options. One, you're going to die in the easy chair and you'll be fine financially. Number two, you're going to fall down on your way to the dining room, fracture your hip, end up in a skilled nursing facility, and spend all your money there. Or you'll be fortunate, live a nice long life, but spend all your money out before it ends at the assisted living facility." So they laughed. He said, "We laughed like heck over it." So if you can use humor to have these difficult conversations, you're going to be, it won't be easy when the time comes, but it will make it easier for you when you're faced with those tough situations.
Yeah, absolutely. I just went through this with my own mother. I'm 500 miles away and my sister's 500 miles in another direction. I'm on a business trip, which adds a whole other ripple effect that I can't be there to help. And you know, it was nice that we actually knew how to navigate this issue so that, you know, it was pretty seamless for my mom. She didn't have to really worry. We had it all going on behind the scenes for her. So I just can't stress how important it is not only to talk to your clients about having a plan for care so that it can be just something seamless, not unpleasant, but also that they can prepare financially for that because they may want to experience a higher level of care. So with that, I'm just going to say thank you again for taking time today. It's been a pleasure. And I'll be back in the future with more content.